Well, every day researchers are working really hard to find new treatment options, especially for those complicated illnesses. So we are especially honored to have Dr. Nancy Mendenhall. She is the medical director at UF Health Proton Therapy Institute to join us today, because we know you are so busy in all this research and all of these clinical trials. Thanks for joining us.
My pleasure. Thank you so much for having me.
So let's talk a little bit about, a big part of the Institute's work is this clinical research. So can you give us a little bit of background and some details on the program itself?
Sure. Well, we opened in 2006, and we were very excited to bring this new radiation technology to the state of Florida and to the city of Jacksonville. Because we thought that it held great promise for better outcomes for cancer patients. But we knew at the outset that the promise needed to be proven through clinical trials and clinical research studies. So we treat a variety of malignancies, and in almost all cases, we have clinical trials and outcome tracking research going on. It's not necessary to be a part of any research study to be treated at the facility, but the majority of patients elect to be part of either an outcome tracking protocol where their outcomes are recorded and studied, or part of a clinical trial. So we've completed over 25 clinical trials, and we've now treated close to 8,000 patients, the majority of whom have been somehow involved in clinical research.
And it's not so much just to make sure that their cancer hasn't come back, but also the long-term side effects of treatment, because this is why you want to get away from more traditional radiation and see if this proton therapy could be better for them in the long run.
Exactly. And so, our early experiences in prostate cancer, for example, suggest that we may have better disease control and we may have fewer side effects, but this needs to be proven. We need to do prospective comparative studies to clearly show that there either are or are not differences. So we're elated to have learned this past November that we've been awarded a major contract to perform a prospective comparative study in prostate cancer. This study is going to involve 42 institutions across the country. About half of them are proton facilities and about half are conventional radiation facilities, and 3,000 men with prostate cancer. And we will compare the outcomes of the men treated with protons with the outcomes with the outcomes achieved with conventional radiation.
When does this trial start, and how can someone participate if they're interested?
So the trial should start within this next year, and anyone who's interested can go on our website to learn more about it, or there will be a website for the trial itself. And there'll be a link for that through our website. The patients who are interested can be seen at any of the 42 institutions, and they will be offered the participation if they're eligible.
Is there anything else in terms of proton therapy for prostate cancer research that you're looking to gain from this? Is it a one-size-fits-all type of treatment with the proton, or there are some variations or options that they can participate in?
Yes, and so I'm glad you asked that. In this study, there are options both for conventional radiation and for proton therapy. And within the proton therapy option, there's an opportunity to be part of a randomized study comparing two different radiation treatment courses, a short course and a long course. It's our hypothesis that the short course will be as effective and as safe as a longer course, but much less inconvenient to the patients and less expensive as well.
And that's what research is all about. So hopefully
Yes.
you have the short course in the future.
Yes.
Dr. Mendenhall, thank you so much for joining us. We appreciate all you've done here.
My pleasure. Thank you so much.
And of course, we'd like to thank UF Health Proton Therapy Institute for sponsoring this segment. For more information, you can visit floridaproton.org. That's floridaproton.org, or give them a call at 904-588-1436.